Senator David Gowan here. Welcome to another edition of Gavel with Gowan. I'm thrilled to give you an update on what's been happening at the legislature. After being re-elected by my constituents to represent my district in November of 22, I was honored to be appointed chairman of the Military Affairs, Public Safety, and Border Security Committee. Border security is a complex and contentious issue in Arizona. Given its location along the U.S.-Mexico border, in recent years, Arizona and my district have been at the forefront of national debates on immigration, with many residents and policymakers advocating for stricter border controls and increased enforcement measures. We have implemented a range of strategies to enhance border security, including the deployment of additional Border Patrol agents, the use of surveillance technology and drones, and the construction of physical barriers such as walls and fences. Border security is necessary to combat illegal immigration, drug trafficking, human trafficking, and other criminal activities that threaten public safety and our national security, which is why I sponsored Senate Bill 1309, which puts stiffer penalties on unlawful fleeing of law enforcement. This will combat criminal evasion from law enforcement officers trying to prevent border criminal activity. I have also sponsored Senate Bill 1311, which puts money into the Department of Public Safety and the Sheriff's budget for training and prevention measures to help stop human trafficking in our state and on the border. Next, I would like to give you an update on an important bill that I sponsored, Senate Bill 1710. This bill has been passed by the Senate and is headed to the House for their approval. If signed into law, this bill would establish a state hospital governing board and transfer oversight authorities and responsibilities for the Arizona State Hospital from the Department of Health Services to the board effective January 1, 2025. In addition, it stipulates that ASH must admit patients based on their clinical need for treatment and prohibits any admission restrictions based on a patient's county of residence. ASH is a 260-bed facility operated and regulated by DHS that offers long-term inpatient psychiatric care to court-ordered patients with mental illnesses, personality disorders, or emotional disorders. This bill will aid many Arizona residents in need of these services. Lastly, I'd like to note that this was one of the most significant legislative weeks ever, as the pro-life community scored a tremendous victory. We voted on Senate Bill 1600, the Born Alive bill, sponsored by Senator Shamp, on Wednesday, and it is currently moving through the process. This bill mandates that any infant born alive in Arizona must be treated as a legal person with the same rights to medically appropriate and reasonable care and treatment. When an infant is born alive, any health professional present is required to take all medically necessary steps to preserve the infant's life and health. In addition, we held a wonderful March for Life event at the Capitol on Thursday to honor the lives of the unborn children and vowed to always protect the innocent ones that can't fight for themselves. That's it for this week, but make sure to come back for more soon for another update. I will see you soon. Until then, I'm gaveling out. God bless.